Hello, my dear students and my dear friends. Assalamu alaikum and welcome back to lesson for you. Dear friends, I was absent for some days due to my exam preparations. So we were discussing, that we are discussing about the anatomy of the tibia bone as we have it on the screen here, right? So the anatomy of the tibia bone, in this section we have discussed about the external features of the upper end of the tibia. As I had told you that we will divide the tibia into three parts: the upper end, the shaft, and the lower end. So we have the videos of the upper end and we have discussed the upper end. Then we also have the videos regarding the shaft of the tibia, and now we are going to discuss in this lecture about the lower end of the tibia. As you can see, all these features we have already discussed about, which are about the upper end and then the shaft of the tibia. Now the lower end of the tibia bone, we will discuss them. We will mention all those important features of it, and then we will see all those features here in this bone, right? So I had told you for the side determination of this bone that the tibial tuberosity should be anteriorly and the lower end has a medial malleolus. It should be on the medial side, and there is the fibula on the lateral side of your leg, right? So about the tibia bone, it is the bone of the leg, right? You know that we have discussed it in the lectures before. So here I have written here that the lower end external features. My dear friends, the lower end has a few important external features. The most important of them that it has 5 surfaces. The lower end of your tibia has 5 surfaces. And what are those surfaces? Let's see. Here we have the anterior surface, then we have the posterior surface, right? Then there is the medial surface, then there is the lateral surface, and then there is the inferior surface, and some important other features we will also see. So first, if I hold the tibia bone in its anatomical position, right? Okay, here is the anterior surface. This one is the anterior surface. This is the lower end of the tibia. So here I will color it, right? Here is the anterior surface of the tibia. Here you can see it, right, friends? So this is the anterior surface. Then there is the medial surface, and you can see here I will shade it with red color. So this is the medial surface of this lower end of the tibia. Then there is the lateral surface. So here we have the lateral surface also. So I will shade the lateral surface with this green color. There is the lateral surface. Okay, so what is this? This is the look, anterior surface, right? This is the medial surface, this is the lateral surface. Then here you have your posterior surface. That's so simple. This will be the posterior surface, right, friends? The posterior surface. And then there is the inferior surface. So this one is the inferior surface, which will articulate with the talus bone and will make the ankle joint, right? Okay, so how many surfaces it has? It has 5 surfaces: the anterior surface, the medial surface, the lateral surface, the posterior surface, and the inferior surface. So I hope you understand now. Now there is the anterior surface. Then in the posterior surface of it here, which I have shared it with black color, this is the posterior surface. In its posterior surface, if I have this other tibia bone with me, look here. In the posterior surface, there is a groove present here, right? Here is a groove. So this is the tibia bone and this is its posterior surface. So here is a groove present here, which is present in the posterior surface of the tibia, and this groove is for the tibialis posterior, right? This groove is for the tibialis posterior and flexure digitorum longus muscle. The muscles of the tendons of the flexure digitorum longus muscle and the tibialis posterior muscle will be inserted here. So we say that here is a groove in the posterior surface of the tibia bone. There is a groovish part, there is a depressed part which is called the groove of the posterior surface of the lower end of the tibia, and this is for the tibialis, the tendons of the tibialis posterior and the flexor digitorum longus muscle, right? Then my dear friends, there is the medial surface. Look carefully here. This is the medial surface, and this medial surface is a little bit smooth in nature, so there is not so important features in it. So this is the medial surface, right? Then we go towards the lateral surface. In its lateral surface here, it has a facet, it has a groove, it has a notch for the fibula bone. So if I have fibula here with me, I don't have it, I will show you in the next lectures, right? Here is the lateral surface. This is the lateral surface. In this lateral surface, there is a notch present here, which gives the point of attachment for the fibula, for the lower end of the fibula, and it makes the distal tibiofibular joint here, right? It makes the distal tibiofibular joint, as here is the proximal tibiofibular joint, here is the distal tibiofibular joint, right? So this is the fibular notch in the which surface? In the lateral surface, and it shows a little bit roughness in its upper part and a little bit smoothness in its lower part, as I have written here. The upper part is a little bit rough and the lower part is smooth. And the lower part of what? And the upper part of what? The fibular notch. The upper part is a little bit rough and the lower part is a little bit smooth. As you can see here, this is the fibular notch in the medial, in the lateral surface, right? Then there is the inferior surface, and you can see here this is the inferior surface of this tibia bone. So the inferior surface of the tibia bone will make a joint here with the talus bone of your tarsal bones, and it will make the which joint? It will make the ankle joint with the talus bone of the tarsals, right? So this is the inferior surface of the tibia bone, the lower end of the tibia bone. So how many surfaces? All 5 surfaces: anterior, medial, lateral, posterior and inferior. Then you can see here this part of the tibia, of the lower end of the tibia, right, which I will share with blue color here. This is a small head shape, right? A small hammer shape, right? So we said this is the medial malleolus, right? This is the medial malleolus. You can see here this is the medial surface, and here you have the medial malleolus. So we have shown here this is the 6th part of the lower end of the tibia, right? This is called the medial malleolus, right? And the medial malleolus in its lateral part, right? This is the articular facet, as I have shown there, the articular facet of the medial malleolus. So here will be the articular facet of the medial malleolus, and it will articulate with the talus bone, and then it will make the which joint? The ankle joint, right? So about the tibia, the lower end of the tibia, we have said that there is an interior surface, there is a medial surface, there is a lateral surface, there is a posterior surface, there is an inferior surface, and here you have the medial malleolus, and this is its medial surface, and in its lateral surface there is a facet, there is an articular facet in the medial malleolus of it. So this is the articular facet of the medial malleolus. So friends, this was about the lower end of the external features of the tibia bone. In the next lecture we will start with the fibula bone. So I hope you like the lecture, and I hope you have learned something from the lecture. Till then, Allah Hafiz.